Today on The Real Story, a new report looking closely at peak pandemic times, showing an additional 54,000 Connecticut households dealing with financial challenges that put them below the threshold for survival. What resources are available, and how does the state start to recover, and how can nonprofits keep up with the need? We're diving deeper into the data with Connecticut's United Way. But first, COVID making a major comeback in spikes of cases and in people's minds. But is Connecticut prepared? What role does or should government have in public health, whether it's funding, distributing masks and tests, or mandating vaccinations? We're sitting down with doctor and lawmaker, State Senator Saud Anwar, to talk about what Connecticut has learned from the pandemic and what still needs attention. Good morning, and thanks for joining us on The Real Story. I'm Emma Wulfhorst. COVID-19, it's back in our everyday conversations. We're seeing more positive tests, calls to get boosted, and more. But past the emergency declarations and federal funding that's now run out, is our state prepared? What public health policies need to be relooked at, and what's working and what's not? Well, joining me to talk about it all and break it all down, State Senator Anwar, thank you so much for being here.
Thank you so much for having me.
Of course. So as we just said, COVID-19 definitely making a comeback. You know, we've heard over the past couple years that we could see these spikes when the weather gets colder, as we do with a lot of other, respiratory illnesses. But, it's really back on people's minds. And I think you have a unique perspective as both a state lawmaker and a doctor. So, in your opinion, do you feel Connecticut is prepared?
We are far better prepared than we have ever been, for a number of reasons. One of them is that we know this illness very well now. We have dealt with this for the past 3+ years. We know what works and we know what does not work. We also know about this variant, and we are learning very rapidly. So there are medicines that are available, there are vaccines that are available, so we are in far better shape than we have ever been.
Sure. So obviously during the pandemic, we saw a lot of emergency federal funding to, go toward the state and the legislature for different things, for handing out resources like masks and at-home tests and vaccines, as well as financial assistance for people who were hard hit by this. So most of that is now gone. So how is that impacting the state now that that federal funding has run out, and how could it impact down the line?
Sure. So we are all going to be watching this very closely. What we know about the current illness is that it is there. It's going to spread. We are seeing from the wastewater numbers that the cases are increasing, but we are also seeing hospitalizations have increased a little bit.
Okay.
Thankfully, the disease is not as severe as we had experienced about a couple of years ago, even as early as last year. But we know that it's going to, of course, have an impact on the individuals, but it has not reached the threshold to be calling it an emergency. It is something that we have to watch smartly. We have to use common sense approach, make sure we wear our masks, we wash our hands, and the ones who are immunocompromised, they have to be very careful. So those things we have to do, but if there is a change or the pattern changes, then of course the state is prepared because we have those contingencies in place.
And how is this being reflected in our hospitals? Are we seeing a rise in hospitalizations yet?
So the number of hospitalizations have increased, and these are mainly individuals who are elderly, who are immunocompromised, who've had chemotherapy, or have heart disease or lung diseases. Those are the ones we are seeing.
Right.
But we are not seeing them as ill as we have seen people in the past. So that's somewhat of a blessing, and the death rates have thankfully not increased related to COVID directly.
Okay. So, when we talk about resources, we remember during the peak of the pandemic, long lines waiting to get tests, people searching for masks, some stores selling out. With the federal funding no longer available, do you think there will be any issues accessing these resources again? So
we will hopefully be getting more tests, and availability of the tests will improve and increase. The masks, thankfully, are much more available in the community, and there's a smart thing to wear masks for individuals who have immunocompromised status, so it's not like across the board everybody needs a mask. And with respect to the vaccines, now we are a little bit behind at the federal level and at the state level to be able to provide the vaccines, but they are in the pipeline.
Okay. And when it comes to, our healthcare staff, we were just talking about hospitalizations increasing, thankfully not nearly as much as we've seen in the past, but we were dealing a lot with healthcare worker and nurse burnout. That's still an issue that's happening. What can or should the state and legislature be doing to help and support healthcare workers?
That's a very good question. I can share with you this was one of our top priorities. One of the bills that we had worked on was to how do we have a robust pipeline of healthcare workers. One of the victims of this entire pandemic was that the healthcare workers burnt out. They did not want to work, the nurses, the physicians, and the whole works. Right. What we have done is we are trying to have a long-term strategy. We want to try to create incentives, but also identify ways to have a loan forgiveness plan. So we have done some of these things, which will take a long time to work on. But we've also identified ways of how we can treat our nurses better, make sure that they are not overworked, there's no mandatory overtime. And if we take care of our nurses and all of our staff, they are more likely to make this a continued profession for themselves. Right. So those things are in place, and we are very hopeful that we will be able to address some of those now. But going forward, there will be a strong pipeline of some of the smartest and the most caring individuals be part of our healthcare workforce.
We haven't seen this impact just nurses and healthcare workers. It's also been a big burden for our nonprofits here in the state. They're trying to meet these needs that they've seen come up before and now through the pandemic. These nonprofits are the same ones who we saw rally outside the Capitol this year. They were feeling like the legislature didn't provide them enough funding in this past session. Can our nonprofits keep up this pace? Do you think the legislature does need to allocate more funding or provide more support for them?
If you'd ask me, I would say absolutely we need to, because they're doing very important work. After the pandemic, we know that there are many challenges that our society has. As you spoke about, and you'll talk more about it, the number of people who are the working poor or the Ellis community, they are increasing. They need support, they need help. We will have to invest to take care of them, and we will have to invest in our nonprofits to take care of them. So I agree with you.
So let's talk about vaccines here. We've had conversations in the past couple weeks about a new booster coming out. Every time we see a new booster and deal with the recommendations of who should get it, who should not, who can wait, we tend to see the rates of people actually getting the shot go down. I think a lot of people maybe got that initial vaccine a couple years ago and then kind of thought one and done. Why do you think a lot of people are maybe not lining up to get the booster every time we see it come out each year now?
Yeah, so there are a number of factors for this. One of them is for many people, when they get the vaccine, they lose 1 or 2 days. They feel fatigued and tired, and people are working so hard that it's tricky for them to do that.
Right.
The second thing is that there are some rare instances where there are side effects and complex side effects as well for some of the vaccines. So we have to accept that reality too and look at the pros and cons. And the third thing is that the illness is not as evil and dangerous as it used to be when the Delta variant, where it was almost like a death sentence. So now with this illness and having good antivirals in place, people are making a choice to say, okay, I'm going to look at the pros and cons. But that does not mean that they should not take it. That at least the high-risk individuals, they need to take it, because that's going to reduce their risk of getting the infection, but more importantly, they will reduce the severity of the illness. And that is something that's important.
And with that, what are you hearing about the recommendations for the most recent booster that's coming out and soon to be available? What are you hearing about those? I know you just said those who are most immunocompromised or most at risk, but what are you hearing in terms of recommendations for who should get this?
So the current variant that we are seeing, the existing vaccines are not as effective for that.
Okay.
So that's why we need the new booster that is going to help us out be able to address that and reduce the severity of that illness, but reduce the likelihood of getting this. So the ones who are elderly, the ones who's immunocompromised, the ones who have heart disease and respiratory illnesses, they should look at that booster when it's available. It's available now, but it's not as readily available in our pharmacies.
Gotcha. So, as you mentioned, obviously there are some people who can't get these vaccinations for medical reasons, of course, but there are still those who, might be able to, and we do see, as we saw at the peak of the pandemic, some rhetoric against vaccinations. So a lot of doctors tell us they're seeing this not just impact COVID-19 and COVID vaccinations and boosters, but now other shots like flu shots and, infant and child vaccinations. How do you think we get past a lot of this disinformation and the conversation around vaccinations?
Sure, and I think the important thing is that we are getting more and more data around some of these illnesses. So we have, for the adults, for example, we will have a RSV vaccine that has been approved, and people over the age of 60 with respiratory illnesses, they should look at that option too, because last year we saw that people were getting very sick with that as well. Flu, we are used to it and we benefit from that as well every year. I think as soon as we know the severity of the illness, is the choice going to be, is it okay to get sick or is it okay to prevent it? And most of the time people will say it's better to prevent it. And then that's what the choice people will have to make.
And, opinions differ on this, but from your perspective as both a doctor and an elected official, what role do you think the legislature and the state have in things like vaccine mandates and other laws surrounding public health?
Sure. I would say that if the disease is very severe and life-threatening, it's a different situation, like we had experienced a couple of years ago.
Right.
But if the disease is not going to be life-threatening and as severe and as rapidly progressive, then we have to look at it. So mandates may not be necessary when the illness is not as severe, and then the risk to the general population is not as severe, and the treatments are available. So we are in a far different place than we had ever been with respect to the COVID. So it requires to work with a science background and understanding of what's going on, but also looking at the practicalities and the risks and benefits of different choices.
You said at the start Connecticut is in a much better place now than it was with COVID-19 a couple years ago. What do you think the state has learned from COVID-19 and what sort of lessons might we now take forward?
Sure. The hospitals are better prepared. We actually know how to isolate individuals. The healthcare workforce, actually, we have low-grade PTSD with every time we see somebody with that, the COVID, so we actually all worry. We may mask ourselves and get ready, and those things are there. We have enough masks available. We have enough PPEs that are available. And in the community, people are very well educated. They actually, even if they have the slightest bit of fever, not feeling well, they isolate themselves and separate themselves out. So at all levels, we are seeing responsibility. And then we also have a mechanism to be able to get them the medications, getting the tests done. So science has progressed, the people's knowledge has progressed, the healthcare system's capacity has progressed, and the government's ability to navigate all of that has much improved as well. So we have a fine team, and it's something that we are well-oiled. We would rather not have to be well-oiled like the way we are, but thankfully we are.
Well, Senator Anwar, thank you. As always, that's all the time we have, but we appreciate you joining us.
Thank you so much for having me.
Of course. Well, there's still more to get to here on The Real Story. The United Way is joining us in studio to break down the numbers and reality of their most recent report, which shows the pandemic and record inflation left more than 552,000 households below the threshold of financial survival in 2021. What does that mean? What does it look like in Connecticut? And what changes need to be made? Plus, can our nonprofits and resources try to help keep up? Stay with us for that discussion coming up.